Hello, my name is Vincent, and I practice massage therapy, and I incorporate Chinese medicine for the relief of musculoskeletal pain and dysfunction. I started my career in 1995 after suffering debilitating back pain. I sought the care of massage therapy, acupuncture, and Chinese medicine. I found great relief. I then attended school in Fort Collins, Colorado at the Healing Arts Institute, graduating in '95 with a state certification in massage therapy. And a year later, I met my instructor, Heidi Rose, who's pictured here. And I studied with her for 12 years on and off under a private tutorial in natural medicines, and approximately a little over 2,000 hours of private tutorial in natural medicines and physiotherapies. So in my work in specializing in treating people's pains of the musculoskeletal nature, what I found to work best is utilizing deep tissue massage, following that up with one of two options, one being cupping therapy and the other is what's called trigger point acupuncture. So in massage therapy, what we're utilizing in the deep tissue is, of course, a deeper pressure to separate the connective fibers, what you refer to as a myofascial system in the body that gets stuck together and glued, that you feel as knots and pains that restrict motions in your shoulders and your neck and your back. Once we've done approximately 40 minutes or so of that work and targeted those areas, that allows me to actually feel where the body is not releasing, and then we'll target that with the other therapies being cupping and trigger point acupuncture. In cupping therapy, what we're utilizing is glasses that are, this is traditional fire cupping, and we'll trap a flame inside, set it on the body, so we create a negative vacuum. What that does is simply, it pulls a massive amount of blood to that area of tissue that's hardened and tight. That also creates separation in the muscle bands, okay? After that, sometimes, depending on the condition, the acupuncture needles can be inserted into the very center of those knots, and that's going to basically affect aspects of the nervous system that are continually locking up those muscles. So that's just kind of a brief overview of the different modalities that are incorporated into this work. The first thing that you have to understand is, why are you in pain? That's the number one question I get asked all the time. And it's a little complex, and at the same time it's also kind of straightforward. Basically what you have when you have pain, of course, pain can be hundreds of different factors. In my specialty being the soft tissue, that tends to be more what we refer to as trigger points in the body. So these are muscle bands that have become glued together and very tight, okay? So when you look at the body, let's take a piece of steak. If you take and you cut a piece of steak and you get that side profile, you'll see how that steak has all these individual basically bands of white fibrous, what we call a connective tissue, right? So that connective tissue innervates your entire body. There's over 2,000 different forms of it. It's mainly a water body. So when you have constant irritation from a sports that you're doing, that where you're having a bias in movement, whatever sport that may be, when you continuously sit on a desk for 6, 8 or more hours at a time, and again with a bias in movement, holding very certain specific patterns. If you have had a blunt force trauma, like a high-speed deacceleration from a whiplash, and if you have had sickness, if you have had illness, also negative emotions, typically it's predominantly one of those factors, but it's a conglomeration of all of those things that takes that connective tissue in the body and it starts to actually shrink, almost like fabric in clothing, right? So that fabric, if you took it out of your body, you would have a three-dimensional representation, almost like a honeycomb grid of every nerve, bone, organ, tissue, and it would look just like you in space. So it holds you up. It's kind of like the packing material of the body. So a good example to use is remembering that that's a water-soluble body that under inflammation from those 5 factors can create a shortening. So if you look at fabric like in a shirt, if I were to take this and let's say this is a trigger point, or this might be a knot in your body where you have pain. Well, let's put it in the back. So as you get that kind of wrap, you can look and see the lines of strain and tug and pull that are exerted throughout the body. Why? Because that connective tissue doesn't start and end at one space. It wraps through the entire body, through your entire matrix dimensionally. So you get different, what we call strain patterns. And so like say in the back, you can get a pattern of pain that runs down the leg, but you can't really specifically pinpoint it's exactly right here and it ends exactly right here because it depends on the day and the hour. It might feel like it's spreading across the legs, down to the foot, and up the back and up the neck and shoulders. So as that water body has that inflammation factor, and as it dehydrates, muscles are allowed to actually glide because of that water factor. When you get dehydration, when you have constant irritation and inflammation, instead of the fibers gliding past each other and that lubricant, that fascia, it starts to stick because it's drying up. So think of spaghetti or pasta that you leave out on the plate overnight, and it starts to glue together and thicken and harden. That's what we're dealing with. If you come in and this pain is a month old, it's fairly straightforward to deal with. If it's 5 years old, 10 years old or longer, we're looking at multiple sessions. It takes time. So each time a person comes in, we're going back in time and we're actually unraveling these tissues. So again, first when we use a pressure and massage, if you look at my fingers, think of the tissue. If it's healthy, it has blood that moves in between and the different fluids, and it has a gliding factor, right? So it can shorten and lengthen. Well, again, in that inflammation process, as it sticks together and gets thickened and hardened, it even ravels up in on itself and becomes shortened. So you can imagine nerves and blood vessel that pass through that tissue that gets locked down. So this fiber can actually exert 2,000 pounds per square inch. That's some serious pressure, okay? The other thing to keep in mind is, as that connective tissue is, tied in to muscles and joints and bones, it can start to actually mess with the natural postures and curvatures in the body. So you can, if you have neck and shoulder pain, you'll watch people and their head will be kind of forward like this, and the shoulders will start to lift up and that head starts to kind of come forward. Same in the back. Instead of that perfect curvatures, they'll tend to flatten out this way because they've been sitting for so long. So again, the body can mold to these positions that we continuously put it in, and also they're affected by these sudden impacts and traumas. So going back to the cupping therapy, everyone's pretty familiar with massage techniques. Cupping can be challenging for the Western mindset because it feels good when it's being done because it's decompressing. So again, taking those fibers, and instead of pushing and pulling them apart, well, we're actually pulling them apart, decompressing them and holding them in that space for 5-10 minutes or longer. Now, what that does is it brings up blood that's been stagnant, different fluids, different metabolic waste byproduct in the tissue up to the surface. So you can get a reddening discoloration. It can be light pink. It can turn as black as the door. And the reason for that is not necessarily because we're inducing a bruise or trauma to the body. Why? Because every time I work this person, I'll set that cup on there and use even more pressure, and the more we do it, instead of it turning dark red, it'll turn light pink. So again, think of all that tissue that's, instead of being nice and fluffy and open, it's now collapsed on itself, it's thickened, it's hard. So if it's thick and hard like that, it doesn't allow a blood flow to properly do what it does.